Substance abuse is a serious problem that affects millions of people worldwide. It's a complex issue that doesn't discriminate, impacting individuals regardless of their age, gender, or socioeconomic status. The consequences of substance abuse are far-reaching and can devastate lives, families, and communities. It affects people from all walks of life, from teenagers experimenting with drugs to adults struggling with alcohol dependency. No one is immune to the risks and dangers associated with substance abuse. It's about more than just using drugs or alcohol. It's about the patterns of behavior that develop and the dependency that forms over time. Substance abuse can start innocently, but quickly spiral out of control. It's about how that use takes over someone's life, leading them to neglect responsibilities and daily activities. They might miss work or school, and their performance in these areas often suffers. They might use despite knowing the harm it causes. The warnings on labels and the advice from health professionals often go unheeded, as the need for the substance becomes overpowering. Their work, relationships, and health can all suffer. Arguments with loved ones become more frequent, and their physical and mental health deteriorates. Substance abuse takes a toll on the body and mind. Physically, it can lead to a range of health issues from liver damage to heart problems. Mentally, it can cause severe emotional and psychological strain. Physically, it can damage organs and increase the risk of diseases. Long-term use can lead to chronic conditions that require ongoing medical treatment and can significantly shorten a person's lifespan. Mentally, it can lead to depression, anxiety, and even thoughts of suicide. The emotional burden of substance abuse can be overwhelming, leading to feelings of hopelessness and despair. The impact of substance abuse goes beyond the individual. Families often find themselves in turmoil, struggling to cope with the behavior and consequences of their loved one's addiction. It affects families, communities, and society as a whole. Communities may see an increase in crime and a decrease in overall quality of life as substance abuse becomes more prevalent. Counselors need to understand these impacts. They play a crucial role in helping individuals navigate the challenges of substance abuse and work towards recovery. This understanding is essential for assessment. By comprehensively evaluating a person's situation, counselors can identify the underlying issues contributing to the substance abuse. It helps counselors see the whole picture. They can then develop a treatment plan that addresses not just the substance use, but also the emotional, psychological, and social factors involved. They can then create a treatment plan that addresses the individual's unique needs. This personalized approach increases the chances of successful recovery. This is about getting to the root of the problem. Understanding the reasons behind the substance abuse is key to providing effective treatment. It's about helping someone reclaim their life. Recovery is a journey, and with the right support, individuals can find their way back to a healthier, happier existence. It's about giving them the tools to stay healthy and sober. Through therapy, support groups, and ongoing care, individuals can build a strong foundation for long-term recovery. Addiction is a disease. It changes the brain. This makes it hard to stop using substances even when you want to. Withdrawal symptoms are a hallmark of addiction. These are physical and mental symptoms that occur when substance use is stopped. They can be very unpleasant. Symptoms vary depending on the substance. They can include things like nausea, sweating, and tremors. Addiction also involves tolerance. This means needing more of the substance to achieve the desired effect. Tolerance develops over time as the body adapts to the substance. Addiction is a chronic, relapsing disease. It requires ongoing management. Treatment and support are crucial for recovery. Substance abuse doesn't discriminate. It can affect anyone, regardless of their background or circumstances. It affects people of all ages, races, and socioeconomic backgrounds. From the young to the elderly, no one is immune to its reach. Common substances of abuse include alcohol, opioids, stimulants, and marijuana. Alcohol is widely available and often consumed in social settings. It is often seen as socially acceptable, making it one of the most commonly abused substances. However, it is a powerful drug that can have serious health consequences. Alcohol abuse can lead to liver damage, heart disease, and various cancers. Opioids, which are often prescribed as painkillers, are highly addictive and can be deadly. The opioid epidemic has devastated communities across the country, leaving a trail of destruction in its wake. It's a major public health crisis that requires urgent attention and action. Stimulants like cocaine and methamphetamine are highly addictive and can cause severe health issues. They can lead to heart problems, paranoia, and psychosis, severely impacting the user's quality of life. Marijuana use is becoming increasingly common, especially with its legalization in many areas. While it can have therapeutic benefits, it can also have negative consequences, particularly when used excessively or by young people. This is especially true for adolescents, who are more vulnerable to its effects. Their brains are still developing, making them more susceptible to the harmful impacts of substance abuse. Substance abuse counseling has evolved. It's not about punishment or judgment. It's about compassion, understanding, and evidence-based practices. Modern counseling is respectful, complex, collaborative, contextual, multicultural, and ethical. Counselors recognize that addiction is a complex disease. They use evidence-based practices to guide treatment. These practices have been proven effective through research. They are tailored to the individual's needs. Counselors create a safe and supportive environment. They work collaboratively with clients. They understand that addiction affects people from diverse backgrounds. They take into account cultural factors in treatment. Ethical considerations are paramount. Section 5. Tailoring treatment. The individual matters. One size does not fit all in substance abuse treatment. Rigid treatment methods are, well, ineffective. Every individual is unique. Their experiences, needs, and goals are different. Individualized, evidence-based approaches are essential for success. Counselors conduct thorough assessments. They gather information about the individual's substance use history, mental health, and social support system. This information helps tailor treatment to the individual's specific needs. Treatment plans are dynamic. They are adjusted as the individual progresses. The goal is to provide the most effective treatment possible. Section 6. The power of partnership, counselor and client. A strong therapeutic relationship is crucial in substance abuse counseling. It's about collaboration, not control. The counselor is not there to tell the client what to do. They are there to guide and support them. Client self-efficacy is paramount. This means believing in one's own ability to change. Counselors empower clients to take ownership of their recovery. They help them develop coping skills and relapse prevention strategies. The therapeutic relationship is built on trust, respect, and empathy. The counselor provides a safe and non-judgmental space. The client feels heard and understood. Section 7. Substance use. A spectrum, not a binary. Substance use is not black and white. It's not simply about being a user or non-user. It exists on a continuum. People can move along this continuum throughout their lives. Some individuals may experiment with substances without experiencing significant problems. Others may develop mild, moderate, or severe substance use disorders. It's important to recognize that addiction is not a moral failing. It's a complex disease that requires professional help. Section 8. Beyond recovery, goals for a fulfilling life. Substance abuse counseling goes beyond just stopping substance use. It's about helping individuals live healthier, more fulfilling lives. Goals are set collaboratively with the client. They may include improving relationships, finding stable housing, or pursuing education or employment. Counselors help clients identify their strengths and resources. They support them in achieving their goals. The focus is on overall well-being. Section 9. A holistic approach to healing. Substance abuse is a complex issue that affects individuals on multiple levels. It is not just a physical dependency, but also involves emotional, mental, and social challenges. Therefore, it requires a multidimensional approach to treatment, one that addresses all these facets comprehensively. Counselors recognize the importance of addressing all areas of a client's life. understanding that each aspect is interconnected and can influence the other. This includes their physical, mental, emotional, and social well-being. A holistic approach ensures that no part of the individual's life is neglected. Treatment plans may include individual therapy, group therapy, medication management, and support groups. Each component plays a crucial role in the recovery process. Counselors also address social determinants of health, which are the conditions in which people are born, grow, live, work, and age. These are the factors that can influence a person's health and well-being, such as poverty, discrimination, and lack of access to resources. Addressing these factors is essential for effective treatment, and lack of access to resources. By understanding and mitigating these challenges, counselors can provide more effective support. By taking a holistic approach, counselors can help clients achieve lasting recovery. This method fosters a deeper connection and understanding between the counselor and the client. It's about understanding the whole person, not just their addiction. It's about seeing them as a complete individual with unique needs and strengths. It's about helping them create a life worth living, one where they can thrive and find joy beyond their struggles.